Llewellyn King here, co-host of MECFS Alert. A lot of excitement among patients about what is called the Norwegian treatment or the Norwegian therapy. Here from Norway to tell us about it is Torsten Pålrød. Torsten, welcome to the broadcast. Tell us about the experience and the hope and the limitations of where we are now.
Thank you so much. So two physicians in Bergen, Norway basically found by accident that B-cell depletion agents do help patients with CFS to really almost get back fully into work. And so there was the first patient number 0, was a patient which has had cancer as well as a chronic fatigue syndrome. And after a couple of months of treatment, which is a normal treatment for that kind of cancer that person has had, all CFS symptoms have been gone. And then they tried to understand what kind of medication they were giving to that patient. And then they thought they identified one of the compounds, and then they did give that to a couple of pilot patients after it was approved by the ethical committee, because obviously you are not allowed to use drugs which are not approved on patients and without getting through an ethical committee. And well, they have done all this paperwork and it worked out well for these pilot patients, and that was published some time ago. And then people got really excited, and they have been running double-blinded clinical trials. Randomized double-blinded clinical trials. That means where the physicians didn't know which patient group did obtain the treatment of, including basically there was B-cell depletion agents, and which patients did just obtain saltwater injections. And it showed that in that clinical trials with 30 patients, 67% of the people who did obtain those compounds for which did B-cell depletions in the body have had a benefit from the treatment. And that has been published in PLOS ONE recently. PLOS ONE is a well-accepted, peer-reviewed scientific journal, and it has been in the news in Europe quite a bit, especially in Norway and European countries. But the media coverage in the US was somewhat limited. Currently we are looking for partners in the pharmaceutical industry who want to team up for clinical trials. And well, you basically can put a name tag to those companies who do have those compounds in a pipeline. One company is Roche, the next one is Genentech. And Genentech is basically the American branch of Roche nowadays. The other companies who have access to those compounds are GlaxoSmithKline and Human Genome Sciences. But so far the interest of the pharmaceutical industry is just not existing.
These compounds have not been used to this point in time to treat cancer in the US. Is that correct?
No, that's not correct. All those compounds, for example, this rituximab, which is Matera, that is something which is produced by Roche, and it is used for cancer treatment in the United States. So the physicians in the US do know the side effects and do know how to handle that stuff. Human Genome Sciences now recently got approval, FDA approval for the treatment of lupus. That was, I think it was this year. And those compounds are also doing B-cell depletions.
Why do you feel there's some reluctance for these companies to be interested in CFS?
I don't know, it's really hard to tell. I think it is most of the people do not realize that that is a severe disease. And if you listen to the researchers who have been running the clinical trials in Norway, they are by training they're oncologists, so they are treating cancer patients on a daily basis, and they claim that those patients are really affected as securely as late-stage cancer patients. And I think that is something which has not been really fully understood by society.
And why is it so expensive? We've been told that it's $7,000 for an infusion. That's a lot of money.
Well, you know, but you do have to understand pharmaceutical industry as well, because they did put a lot of money into development of those biologics, antibodies. It's really, it's a lot of effort to really produce that stuff and test it. And so I do understand that this has a price tag. And it's not the price tag of aspirin, you know, which people found by accident, you know, while walking around the woods and just chewing on some wooden sticks. So that is a totally different ballgame.
Finally, how do we guard against too much hope in case down the road maybe there's relief for a year but not for life? New drugs tend to be oversold. Expectations tend to be too high.
I think
Does that worry you?
Well, it is definitely, you really have to be aware of the fact that CFS currently you don't have a biomarker, so you cannot pick all the patients which are responsive to that treatment. And I'll doubt it that all patients which are currently diagnosed with CFS-ME are basically included in the group which will be responsive to that treatment.
Thank you so much. And very good luck. It's promising.
Thank you.